Hey guys, I'm Sebastian and this is Don. We are going to show you some great exercises today to help protect the knee. That's right, your knee needs protection. People like to call them bulletproof knees. Let's try that.
That'd be nice.
Yeah. By the way, we're locally world famous. It's trademarked now.
Locally world famous.
We're in Costa Mesa, California. We can help you virtually or in person. So we're going to cover 3 exercises today, which are our favorite. Obviously, there's many different exercises. We might do other videos later on this. You should subscribe to our channel if you want more of them. But we're going to try to stump each other a little bit, so this will be a fun game. Do you want to be first as doctor or patient?
Patient.
Patient first. Okay, go ahead and line your back for me. All right, so now I think it's probably important to start just by mentioning that some of these exercises are going to be helpful to you and some of them aren't. Okay, it's really based upon the assessment and figuring out exactly why your knee is hurting in the first place. However, we have heard about the quad hamstring ratio and whether it's skewed one way towards the hamstring or towards the quad or so on. I think we find generally that in normal populations, such as like people who aren't generally athletic or even just general joggers, not sprinters, they tend to lag on the hamstring component. Okay, so I'm going to steal yours. Lay face down. So we're going to load up our hamstring a little bit. And so I'm going to do it manually here. So when you see your squirm on the next one, it's because I just stole the one we talked about with you. Okay? And so you can put something like a resistance band kind of loaded that way. But we want to go to the point where we have full hamstring range of motion that's getting challenged. And so bring that right there and hold it there. I'm going to be watching your hip. Okay? Keep your hip pinned to the table as you don't let me pull you. Okay? Slowly let me win now. Slowly let me win. Okay? We're going to go the whole way. Slowly let me win. Pin it to the table. Pin it to the table. There we go. All the way, all the way, all the way. Here we go, here we go. Good. Good job. Okay. So that's one. Can you show me a bad rep?
A bad one?
Hips up. There we go. So this is complete bullshit. Okay? Relax. Okay, so she's destabilizing from the center here. And we need to make sure that she has proximal stabilization to get this area to work well. Okay? And so, yeah, we can bias it towards internal and external rotation, but generally speaking, most people do very well with the general approach. If you pin it to the table, don't let me pull you. Okay? And obviously, you can use a weight stack or a band or something of that nature. Reps and sets, in my opinion, do not matter. Just make it challenging. Okay? Now what?
It's a good one. Okay. So I think that I'll stay on that hamstring route. Say you don't have anybody to, let me get in the camera view here. Say you don't have anybody to take you through that, or you don't have any weights, or you don't have any bands, or anything of that sort. I'm going to put you on the ground, Seb.
Okay. You're going to, yeah, that camera will, well, I think you can just tip it.
Okay.
I think we can just tip it now. I changed the setting. That work okay?
Beautiful. All right. So what I'm going to have you do is do a glute bridge for me. Okay, squeeze your butt cheek so hard at the top, don't lose it, and slowly slide your socks down. Slide, 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 all the way. Full extension, keep the glutes squeezed the entire time. Okay, and then once you get to the bottom, you can drop the butt, just glute bridge back up, start again. So we're slowly lengthening the hamstrings while keeping them active, and same thing with that pelvic position he was talking about on the table. So don't let it sink like so. I want you to continue to squeeze your butt cheeks together as you go through this motion.
Good. By the way, furniture sliders work pretty good. We just kind of are going at like improv style right now.
Sure. Socks and a tile floor work well too.
Yep, they do. Or some people have probably stolen those trays from the drive-in diners. Okay, so we're on the third one then. So we did 2 hamstring ones. We can do a quad one because actually it's probably merited that the ACLs or post-op ACLs probably need a little bit of quad attention. But it's probably important to note that actually there's other exercises up above into the hip and to the foot which are actually going to be probably more important, you know. There's not oftentimes, other than like post-op, then we end up going into this quad or the quad area too much on people. But I'm going to show you one that's very comprehensive. It'll cover a lot of ground. As you'll see, she'll have to use her her belly area too. And so we're going to do something called a reverse Nordic. Okay, so go ahead and ground there for me. And all right, so the only crummy part here is that we need something for Dawn's knees, but I'm not that nice.
It's okay.
Okay, and so let's go toes on the ground for me. Here we go. I can see the holes in your socks. We should get you some new. Yeah, right in the heel.
Oh man.
Okay, so can you squeeze your butt cheeks really hard? By the way, I hope you guys are seeing a commonality here. Good. Let's go hands on chest. Good. Slowly drop back as if you're in the Matrix and you're dodging a bullet. Good. Back up. Good. One more time. Can you show me good and then show me a bad one after? Good. Slowly drop back. Slowly drop back. Good. Push up through the feet. There you go. Show me a bad one. Good. So she's bending at the low back and now she's sinking at the hips. Okay. Show me one more bad one. Can you sit your hips back to your heels first and then drop back? So this is extreme cheating. Look how far she can go back now. Okay. So it's about having a plank and then sinking back. Yes, she's going to feel her quads and back up, and she's going to feel her belly wall as well.
That's a good one.
There you go. Yeah, it's kind of nice to not have a script.
So those are two muscle groups that will attach to the knee joint that can help aid in it. We have other videos as well that will target the hips too. So you guys go type in knee pain. The hips are a really important part for you to focus on sometimes with knee pain issues as well, because we call the knee a dummy joint sometimes, and when you're trying to find movement through either your ankles or your hips and you're not able to find those movements because there's lack there, you try to find it through the knees, and that's when knee pain starts to occur. So there's more exercises on there that you can try as well to target the hips and glutes.
Yep. And if this worked for you, or you guys are interested in more that we do have a free gift for you. It's something that is going to pop up on the screen here, or you can click in the link description below. It takes you to a free gift that we have. Again, we have a lot of videos on here which are free as well. We have tons of free content. So if you're looking for something that's actually a roadmap or something that's more less haphazard, because I know you guys randomly click on YouTube videos. I do the same thing when I'm looking how to find gold in the Sierras. You know, you just find there's no structured plan. You just kind of find stuff. And so if you want structure, go through and click on the link. And if you want someone to one-on-one guide you, we are open at this time.
Virtually or in person.
That's right. We're essential business. I don't know if you guys know that. So, anyways, we'd love to help you guys out, and it's pretty simple via virtual. As you can see, if you had a success with this video in these exercises, virtual can help you.
Absolutely.